Hi, my name is Ron Royer and I'll be demonstrating a female catheter, and it will begin by doing a pan of the area here. Okay, we've completed all our pre-steps, and I've let the patient know that they will be putting a catheter in her. We'll begin by opening up our tray here, get our Foley catheter out. And that garbage is over here. First we take the tab, open that up away from us. And I'll take the gloves and I'll set them to the side for later. Okay. This here we want to make sure that we only touch the outside hinge. And of course we put the shiny side down. So we'll go ahead and back into her a little bit here. Okay. Now this we won't be using. So I'll go ahead and just throw that away. Now I'll go ahead and put on my gloves. I'll step back. There we go. Okay. We'll go ahead and open up our swabs here and get them ready. Throw that away. Open up our lubricant. Get that ready. Okay. Now we'll go ahead and transfer our box here. Now the first thing we'll do is go ahead and test our balloon. And it's working fine. Okay. And then we'll take off the bag and have that ready for us. All the while being very careful so as not to contaminate the catheter. Okay, the next step then, we'll go ahead and I'm going to contaminate my left hand because we're going to have to open up the labia majora to be able to see the meatus, to be able to clean with our swabs. So I'm going to go ahead and do that. Okay, now our first one, we're going down one side. Second here, let me see if I can open this up just a little bit. While maintaining 1 inch on the side. And we'll go ahead and throw that away. We've got to make sure when it's dirty you don't go across. Go down the other side. Now down the middle. Okay, now that that's clean, what we'll do now is go ahead and insert the catheter and we'll apply some lubricant. Okay, you want to bring it in until you see some urine. There, we got some urine. now we want to inject the bubble. And this came off, so I'm going to have to re-insert this. I'm going to be very careful. If you see any pain or grimacing, you want to stop. Okay. Now the next thing you do is, without tugging, you want to make sure that it's stable, and it appears stable. Okay, now we'll go ahead and clean up our mess here. So I'm going to go ahead and put the bag here next to us. Put the bag in here. Go ahead and clean this up. Okay, I'm going to go ahead and change gloves here now. Now the next thing we'll be doing is taping the catheter so that it doesn't move, cause any problems. Make sure it won't kink and so on. We'll place the bag on a stationary part of the bed. Okay. Okay, so we'll go ahead and secure the catheter. There. And then we'll place the bag on the bottom here. Okay, now the next thing we'll be doing, of course this would be up around here, and we can also attach it to the bed. But we want to keep it somewhat coiled in case there's some movement. I want to be careful there. But the next thing we're going to do then is get a sample. The doctor has ordered a urine sample. So the next thing what we want to do is have our syringe and cleaning material and bottle. So we'll go ahead and clean the area that we'll be taking the sample from. Go ahead and throw that away. Now when we're taking a sample, you want to be careful and put it in at an angle so that you get a nice clear sample. And you want to get probably, well, 3 cc's or so anyway. Now if there wasn't any urine in here, what we'd have to do is clamp it. But since there is urine in here, we can go ahead and get some of that. So the next thing is, we'll go ahead and open up our bottle, keeping the top down, clear. Bring that in, disconnect the sharp. You want to make sure the needle is safe. You want to date and time this and get this to the lab within 15 minutes. Now that we've got the sample, the doctor also said that we can discontinue. So the next thing we want to do to discontinue is talk to the patient, let her know that that's what we're doing. First thing you want to do is drain, and you want to make sure you prime your syringe, because the solution will come in to the syringe. There, we got the water back, so we can go ahead and leave that. Now you want to have a towel handy, because we'll be pulling this out here now. So we'll go ahead and disconnect the catheter here. And now I'm going to pinch it to hold it and pull it out. And we want to make sure we take a look, see if everything is intact and so on. I'm going to go ahead and take this, disconnect it, and throw it away. All the while, now what we want to do is make sure she's comfortable, get her covered up, the bed lowered, call light, and so on, all the post steps, and document, complete the DART. And that completes our catheterization for female.